Hi, I'm Martha. I'm here at Infinite Strength Conference on behalf of our MBC Life podcast. And I'm here with a wonderful doctor who just spoke about building trust in the patient-doctor relationship. And I wondered if you could introduce yourself first.
Absolutely. My name is Dr. Sammons, and I'm a breast medical oncologist at Dana-Farber Cancer Institute, and I'm Associate Director of our Metastatic Breast Cancer Program.
Oh, actually, I did not know that, so we're going to jump into that. What do you do at that center?
Absolutely. So we have a metastatic breast cancer program at Dana-Farber that's called EMBRACE, which stands for the goal of ending metastatic breast cancer for all. And EMBRACE really has two different facets to it. It is a research program and a clinical program. As part of the research program, we offer enrollment to every patient that has ever been seen at Dana-Farber, and it is really a clinical trial screening mechanism. So every patient with MBC who walks in our door, we have staff that reads about them, understands the genomics of their cancer, and helps us screen them for sort of personalized clinical trials that we might have ongoing. We also follow metastatic breast cancer patients who consent to the program to do research projects to obviously learn more about metastatic breast cancer, different types of metastatic breast cancer, to learn more about it, about how patients respond to certain treatments. We do a lot of genomic research as well through that program. As part of the clinical program, it's really an educational program that's open to any patient. And we put on monthly webinars about the newest updates in treatment for metastatic breast cancer, common topics in metastatic breast cancer, like we did one this year about scanxiety and the anxiety of going through scans and with a social worker and a patient and how to handle that. Sexual health with MBC is a topic. This month we're doing one specifically about the best ways to treat metastatic breast cancer that spreads to the brain with two experts. So we have educational webinars that we put on through the program. We have support groups for metastatic patients through the program as well.
Okay, that sounds amazing.
Yeah,
I think I actually have attended one of the webinars.
Yeah.
I didn't realize that was EMBRACE.
They're all recorded, and we actually have a YouTube channel, so anybody can look up Dana-Farber Breast Cancer Institute, Metastatic Breast Cancer Program EMBRACE, and there should be a link to the YouTube channel and everything we've done for the last couple of years.
Wow, what a great resource.
Yeah.
So your talk today, you talked about how to build trust with your patient and your patient building trust with you. What's your kind of like key takeaways in terms of how to make that happen?
I think trust between a patient and their physician it's really essential. There's no other way to put it. I mean, you are putting so many important decisions about your life in our hands, and you obviously have to have a great deal of trust and respect in that person. Communication is essential to any relationship, and open and honest communication is the absolute foundation of the physician-patient relationship. So feeling comfortable asking the questions that you have with that provider, and having a physician that is comfortable in answering the questions that you might have. I also think it's really important to advocate for yourself. Every patient is different in the way that they want to receive news, particularly when we're talking about metastatic breast cancer. Some patients want to know, what's the average amount of time a treatment might work. Some patients want to know information about prognosis. Some patients absolutely do not. And I think, being honest with your physician about, how much you want to know, how you want to receive information, I think most oncologists would be very happy to receive that, and so that we can meet your needs as well, because every patient is really different in that respect, and how we can best communicate with you. So if the patient knows kind of what style of communication that they prefer, I think sharing that with your provider is really important.
So you think that kind of is sufficient to build trust with like that's the cornerstone.
I think open communication and honesty and respect are really the baseline.
It's so hard to do that sometimes for some people, and at certain points, do you have any advice for people who trust the medical care of their doctor, but they have a hard time opening up in terms of the communication, like opening up about what kind of support they need or issues that they're facing in their lives? Like, what if your patient isn't able to do that?
Yeah, I think it's a good question, right? Because there are constraints in the time that we have with each patient, and we're trying to get through so much in a 15-20 minute encounter that is often about treatments and scans and the side effects of therapy, and we're not always able to get into treating the whole person, which is so important, about things like, how are you handling this diagnosis? How is your mental health? How are your relationships? How is your sexual health? Is there anything that I can be helping you with sort of as a whole person? I'm not going to say that it would be wonderful if every oncologist could just sort of take the last 5 minutes and think about the whole person. Sometimes that's possible, sometimes it's not. There has to be some degree of self-advocacy, a little bit, I think, in being able to say, I don't think my mental health is in a good place, or I'm really struggling with anxiety, or I'm really struggling, with intimacy with my partner. Are there any resources available to me? The other thing is a lot of oncology practices have a whole team that's available. A nurse practitioner, a nurse navigator. If you don't feel entirely comfortable, or there's just not enough time in that session to talk about some of those other things, reach out to the nurse navigator, reach out to, the nurse practitioner. Set up another appointment, send them a message, If it doesn't come up in the confines of that appointment, you can always message them on the back end. And at the end of the day, if you're not getting what you need, but you're doing all the self-advocacy that you can, then you have options there too. Like seeking a second opinion or things like that.
You did talk a little bit about shared decision-making, and somebody had a pretty interesting question about decision paralysis, which would be like, if you can imagine this, you are presented with numerous options, and I like how you said you don't come in and say, we could do this, or we could do that, or we could do this, and provide no guidance. And sometimes it does feel as a patient that a lot of doctors think that's what shared decision-making is, or patients have a fear that that is what shared decision-making is. How do you describe
Shared decision-making?
Yeah.
So sometimes there's an obvious answer on what should be the next best step.
Yeah.
And if there's an obvious answer, it's always easy as a physician to go in and say, this is what has happened, this is the situation, and this is what I think we should do. And sometimes that happens. But sometimes there's not always an obvious answer. And sometimes there's two options. Or sometimes we recommend something, but it's not in line with the goals of the patient. That's kind of where patient-shared decision-making comes in. It's me talking to the patient about what the options are, what I recommend, and making sure that that's in line with your goals, with the patient's goals. So when I'm talking about that, I mean, that's it's because every patient is different. Some patients want the most effective therapy. Give me the most effective therapy with the highest response rate. I don't care if it's IV and I'm gonna lose my hair and it has a lot of side effects. I want the next best effective therapy. Yeah. And if that's what you want, then that is what you should tell the doctor, and that is what we can offer. But sometimes if there's two options, and one might be slightly better than the other, but we could always save it until the next line, but one is oral without hair loss and has less side effects, and one is IV and has hair loss and is really gonna have a lot of side effects. That's where sort of knowing what you're ready for, what you want, that's kind of where patient-shared decision-making comes in, in my opinion, if that makes sense.
Yeah, it does make sense. It's just very hard as somebody with metastatic breast cancer, especially if you're newly diagnosed. Like, you are thrown into a world where there's so much you have to learn quickly, but then you are also being asked to advocate for yourself and to understand how to communicate with your doctor and all of these things that actually can make a difference in terms of your quality of life and maybe even your length of life.
I mean, you certainly have to have an oncology physician that you trust, right? Yeah. Nobody is expecting you to all of a sudden become a world expert in breast
cancer. But it feels that way. I'm sure you know that.
I know. No one expects that of you. I think that, if you're ever concerned that you're not getting, the best care, we do live in, the United States. You could always get a second opinion. Just make sure that you're comfortable with your team, that there's open communication, and I think that's the best you can do.
Yeah. All right, thank you. Do you have time to tell us a little bit about breast cancer risk rising, or
I think we're good.
Okay.
Yeah.
All right. Thank you. It was so nice to talk to you.
Yeah, thank you for having me.
Thanks, guys.
Yeah.